The human body, muscles moving, interacting, flexing and releasing, supporting the bones and joints in a miracle of motion. But if a muscle fails to work properly and loses its balance, the whole body is affected. So much of our health is about balance, the balance of energy among various parts of the body. Kinesiology is based on the principle that when our muscles are out of balance, so is our health. We can view muscle movement as if it was attached to an electrical switch. To bend your elbow, the biceps must turn on while the triceps turn off. To return the arm to its original position, the opposite must occur. This is all dependent upon receiving the correct messages from nerve endings in the arm. When the muscle is weak or injured, it may exert the same force as a normal muscle, but its timing may be off, causing a delayed reaction to the neurological stimulus. When that happens, the muscle gets stuck in the on or off position, throwing the other muscles and the body out of balance. A muscle that is stuck in the on position, for example, manifests itself as a spasm or Charlie horse. Restoring proper function to a weak muscle restores balance to the opposing muscle, which has had to compensate for the other's debility. And doing that restores balance to the rest of the body. And that is the basis of a natural health therapy called kinesiology.
Kinesiology basically is the practice of the assessment of movement, performance, and function, as well as the rehabilitation, prevention, and maintenance and management of injuries and disorders that can affect anyone in their home environment or at work, in leisure, and in sport.
With its focus on muscle dysfunction and body movement, kinesiology is the treatment of choice among high-performance athletes and sports injuries. But its application doesn't stop there.
Can also involve working with children, could involve working more with the elderly and people with chronic health conditions in terms of just improving quality of life. It could involve ergonomics, or basically designing workstations and work systems to accommodate every individual. We work a lot with people with cardiovascular concerns, people with chronic conditions of the musculoskeletal system like osteoporosis, and we also deal with probably some of the mixed issues such as fibromyalgia, chronic fatigue syndrome.
The diagnosis comes from the physician, and then in working with the physician or the chiropractor or the physiotherapist, then we can direct treatment thereafter.
Your first visit with a kinesiologist will depend largely on your particular problem, but you can expect a careful analysis with questions about medical history, diet, and lifestyle. Obvious physical difficulties, such as posture or injury, will be looked at, and you will undergo a muscle test. The kinesiologist gently presses the muscle in question to see if it is functioning properly.
We do what's called a functional capacity evaluation. From a kinesiologist perspective, really what we're focusing on is a person's whole body ability to perform function, whether it be in the home or at work. So even though a specific muscle may have a weakness, it's how the person functions as an entire system.
So we don't just look at their knee or just look at their back or just look at their heart. We try to look at the body as an entirety and the person as a whole person, and try to look a little bit more at the psychological health and how that all kind of ties into being a well and healthy person.
Testing results will determine the direction that treatment will take, but usually it means correcting muscle dysfunction through deep massage, realignment, and exercise, all designed to balance weak muscles with strong.
By increasing the body's strength and increasing our cardiovascular strength, we're increasing the entire body, which increases our immune strength as well. So that's very critical to ward off different types of infections, diseases, etc.
In keeping with the holistic approach to healthcare, kinesiologists place as much importance on providing fuel for a muscle strengthening program as on the program itself.
If we're not bringing in the proper nutrients, we're not supplying the proper nutrients to the muscles and to our blood, and as a result, we can weaken our bones, we can weaken our muscles, we can weaken our ligaments. And if we're constantly under repetitive strain type situations, that can lead to muscle tears, it can lead to muscle aggravation, low back pain.
While much of the work done by kinesiologists is rehabilitation, prevention is just as important, if not more so.
We can do an analysis in terms of how someone does their housework or how they function in their work environment. We do work site assessments to see how someone performs what they do. And then what we do is we'll analyze that to see if that's causing some stressors on the body and how we can make changes so that we can make the person more efficient to their workplace. I really believe that more that we can get with the prevention, that we can decrease the rehabilitative side of what we do and, in essence, help people live healthier lifestyles.
What we try to do is give the individual the tools and the capacity to deal with the issue on their own to a certain extent. We help to guide them. So we're actually working with the person to empower them to improve their own health.
Over 20 million North Americans suffer from it. Approximately 1 out of every 4 women over the age of 50 has it. It's estimated that the cost to treat this disease in Canada alone is $1.3 billion a year. The disease is osteoporosis, and while in itself is not painful, the conditions it can lead to are often agonizing, debilitating, and sometimes fatal. As we continue to age, the renewal of bone structure slows down and the bone gradually loses density. For women, the rate of bone loss becomes very dramatic during the first 5 years after menopause. For men, it happens much later, usually in their 70s. For both, when the process is allowed to continue and intensify, the result is osteoporosis.
Osteoporosis literally means porous bones. It means that the bones are breaking down because they're living tissues. They're not static, concrete things. They're breaking down faster than they're being built up, and it leads them to be brittle and easily broken.
Osteoporosis has been nicknamed the silent thief because it develops without noticeable symptoms. Yet every year in North America, more women die from osteoporotic fractures than from breast and ovarian cancer combined.
People who are inactive are more likely to get it. People who are on certain medications like steroids are more likely to get it. Recently it's been shown that if you take high dosages of thyroid hormone, you're more likely to get osteoporosis. Smokers get it more than non-smokers. And there are a variety of other reasons why people get osteoporosis, but by and large it's part of aging, and it's part of the gradual diminution of our male and female hormones.
Part of the reasonings behind this is because during menopause, the production of estrogen is decreased and actually it ends. And estrogen is very important for putting calcium onto bone. So when the estrogen goes, it decreases the amount of calcium that's put on bone, and so the possibility of osteoporosis occurs.
Traditional treatment takes this loss of estrogen into account, relying mainly on prescription drugs and estrogen replacement. Many alternative therapists, however, believe that the focus is on the wrong hormone.
And I believe progesterone is the forgotten hormone, because progesterone and the loss of progesterone is actually what starts osteoporosis long before the loss of estrogen.
Natural progesterone cream made from substances found in wild yams is being used as an alternative to its synthetic counterpart. Practitioners believe that it not only halts the progress of osteoporosis, but reverses it.
The only thing estrogen ever does is slows down the loss of bone. It never builds new bone. The only thing that builds new bone is natural progesterone.
The idea that osteoporosis may be reversed seems to indicate that this disease doesn't have to be inevitable. Osteoporosis may have as much to do with diet and lifestyle as it does with getting older.
As far as diet is concerned, we try not to keep the levels of phosphorus high, but to lower the levels of phosphorus by reducing the amount of refined carbohydrates. And we try to increase the amount of calcium and other micronutrient intake by increasing a person's intake of green vegetables, fruits, and you know, things like low-fat dairy products. All of those would be helpful as far as diet is concerned.
When it comes to osteoporosis, one of the foods you can get a lot of benefit from is soy. Soy has been shown to contain certain what are called isoflavones, or certain phytochemicals or plant chemicals, which will help the bone retain more minerals and more calcium.
If you can't get your required calcium in your diet, some practitioners recommend supplements. A word of caution though, too much calcium has its own range of side effects, including arthritis and kidney stones. And while it's important for strong, healthy bones, other minerals should not be discounted.
Most women not only need calcium, but they also need magnesium, nutrients like boron and silicon, and maybe manganese, zinc, copper. All of those may be involved.
Regular exercise also helps build healthy bones. The contraction of the muscles during weight training exercise actually stimulates the bone and causes it to increase in size.
Osteoporosis is a progressive type of disease, and basically you can treat a person with osteoporosis even when it gets quite severe. You obviously modify your techniques. You don't use as much force on a little 90-year-old osteoporotic lady as you would on a lumberjack, but you can still give them a lot of benefit and a lot of relief. And that would be what our goal would be in somebody in that situation. Our goal would actually be to get to the person far, far earlier and get them doing the proper things to try and prevent osteoporosis. Even when they're a teenager, you can start on the road to preventing osteoporosis.
Before using any of the remedies we've talked about today, make sure you get advice from a qualified healthcare provider. Natural methods of healing work best when they're part of a holistic approach to every aspect of your life and lifestyle. And please, join us again next time as we take a journey once